Hello, my name's Kerry Williard and I'm with the 53rd Pennsylvania and I'm the surgeon for the regiment. The regiment, it consists of 1,000 men. There was one main surgeon, 4 assistant surgeons, and 4 hospital stewards. I was asked to explain a few things about the instruments. This instrument here known as the capital saw, and it was a saw that was utilized to cut the bones. Previous to that, when they would, in the amputation, they would use a knife like this. This is known as the Lister knife. It's a single-edged knife, and the surgeons also had another knife called the Catlin knife, which was double-edged. Generally, the surgery was consisting, it was a circular cut. What they generally did was just select a spot above the wound, and they would make a circular cut. They would peel the first layer of tissue back and make another cut down to the bone and move all that back, and then they would use the capital saw to cut the bone away. And from that, then it was a stepping stone cut where they could move the flesh forward, and then they would suture that at the very end, and they would use things like cat guts, silver thread, silk thread, and so forth. Some of the anesthetics they would use, they had 2. One was ether, and the other one was chloroform. And again, most people think that the anesthetics were the bullet, and I find that not a plausible answer because we had the 2 anesthetics. If you used the bullet, put it in somebody's mouth, and they bit on it, they would probably swallow it and die before I did my surgery. So these were the 2 anesthetics. I prefer to use chloroform because ether you must use out in the open air because it's very flammable. And the other thing is it's very caustic to the face and it burns. 2 ways, and why that was important was because most times they would just very simply take a sponge, put the ether or chloroform on it, and put it on the soldier's face. And if you used ether and you did it in this method, it would burn your face and it actually gave a suffocating effect, so they would be kicking and scampering on the table. Now, I pride myself in a little Yankee ingenuity where we'd use a funnel. And again, if you just took the funnel, put it over the face, and used either ether or chloroform, hold it there about 4 minutes, that would render them insensible for about 15 minutes. And that was fine. The period of time was fine because most surgeons could take that amputation and do it within 5 minutes.